discussion. So for the next discussion, we're talking about we're trying to define terminologies, right? So we're defining what is what unwanted pregnancy, okay, what is unsafe abortion, and what are the complications of unsafe abortion. So this is more of like an introductory video, okay. This is more of like an introductory video, okay. Somebody's actually saying, okay, so we are moving into discussing these terminologies. So for these terminologies, we'll talk about, so unwanted pregnancies, first of all, they are linked, okay. If pregnancy is unwanted, it usually leads to what? Unsafe abortion, okay. So, and when well, I usually have unsafe abortion when the rules are restricted in that region, okay. So when the access is not safe, and everything is restricted, that's when you have high rates of what unsafe abortion. And of course, it has a lot of complications, infections, hemorrhage, a lot of things. Do you understand? So let's define what is an abortion, unwanted abortion. First of all, look at the causes. So causes, one of the first reasons is lack of access to contraception, inadequate sexual education. So the girl child is just growing and she hasn't been highlighted about what sex is, how to keep herself. Do you understand all those kind of things? So if there's sexual violence or coercion, socio-economic challenges like all those wars and disasters, this could actually displace our youngins to a lot of abuses, So impact of unwanted pregnancies, it could lead to emotional distress, it could disrupt the educational career of that person, okay. So the girl child will have to actually stay out of school, because she's pregnant and all of that. There's increased risks of unsafe abortion. All right, so let's discuss unsafe abortion now. First of all, if you are discussing or defining unsafe abortion, it's an abortion performed by untrained individuals, or it is performed in an environment that is not of medical standard, okay. So that's what we got there, okay. So prevalence in Africa has the highest rate, about 77%. The reason is what? Laws are very strict on this side. In Nigeria, that's the country where I'm from, if you perform an abortion as a healthcare provider, you serve 14 years in prison. And this guy is here on live telling me about abortion. Like, I'll never ever do an abortion in my whole lifetime. It's 14 years imprisonment if you do an abortion in Nigeria. So our laws are even more strict than your country, bro. Alright, so globally, 45% of abortion totally are unsafe. But I have to know about abortion. Why? Because I'm a medical student. You must know about things, okay, so that you know how things are happening, So what are the things that usually push or encourage unsafe abortion? Is when the laws are strict, if there's stigma and fear, low awareness of safe options, poor access to what professionals are actually trained, okay. So complications, what are the complications of an unsafe abortion? Could lead to bleeding, okay, lead to infections, uterine perforations, infertility, kidney failure, okay. Psychologically, it can cause emotional trauma, depression or anxiety, then long-term disability, financial burden. So sometimes, guy, the girl will go and do an abortion, she feels it's cheap, complications will set in, and the money she'll have to spend on those complications will be more than anything, okay. So abortion could actually make you broke if not done